4 o'clock. I will go ahead and call the work session to order. The chair knows that there's a quorum of the court present, and the commissioners are here. We're going to do introductions, so I'd like to just go around the table so that everybody knows, and include those audience, so we know who everybody is. So I'll start. I'm Liz Farrar Campbell, the county judge.
I am Sherry Wilson, commissioner.
Pat Shannon, commissioner.
Teresa Aldrich, administrative assistant.
Chris Fitzsimmons, Gilliam County Emergency Management, out of the Sheriff's Office.
Mark Mitchell, North Gilliam County Health District.
Julius Courtney, North Gilliam County Health District.
Paul Bates, South Gilliam County Health District.
Cody Betancourt, South Gilliam County Health District.
Michael Coggin, PA of South Gilliam County Health District.
Kingsbury, PA. Ashley McIntosh, South Gilliam Health District.
I help South Gilliam Health District, and I also work for Community Counseling Solutions.
And I'm Holly Winslow, and I'm the administrator of South Gilliam Health Center.
Daleen Wilson. I'm working with South Gilliam Health Center. I'm doing this feasibility study.
Great, and then we'll do the audience, and then I'll go to the folks who are on our Zoom. I'm Chris Patton, president of Gilliam County.
Denise Ball, Arlington City Council president.
I'm Paul from Arlington.
Okay.
Folks
All right.
on Zoom. If you can star 6 to unmute yourself, or the mute is in the lower, if you came in from Zoom, it's in the lower left-hand corner. If folks could maybe just jump in and just so you all know, the commissioners can see who's on Zoom, but the folks in the audience cannot. And so this is just helpful for them to know who else is joining. Shannon, do you want to start us off?
Sure. Shannon Coppock, South Gilliam County Ambulance.
See, this is why we did that. Hold on 1 second.
She's shaking her head.
Well, it's not.
Does it work?
We're having a sound problem here, guys. Just a second.
Have her try again.
Hey, Lisa.
I messaged her to see if she could hear us, since she didn't answer back.
Okay.
Yes, I can hear you. You're very, very echoing. We don't have any video. I'm just wondering how you're connected.
Sorry, everyone.
We're having technical difficulties.
Pretty much connected.
Stand by, everybody.
Teresa, question for you. Are you logged on through the Zoom platform, or are you logged on as Teresa?
Zoom platform.
Okay.
And I'm doing that little, the little microphone in the corner of our Zoom screen that we went over this morning, and I hit the caret and the owl isn't appearing up there.
He's eating the carrot.
So, yeah, something's not quite connected, right? You might check all the connections. I've had it before where one's come slightly loose, and so it hasn't shown the option of the owl.
Can I be the owl for a minute? This is Les Ruark down by Rock Creek. I'm on the line too.
Les is trying to talk.
Hey, Les, we can't hear you right now. We need to get our technical side fixed on here so we can make sure that everything's moving.
Did he flash? Yeah. He flashed and said hello.
Well, flash red on this side.
It's green on the bottom. Green light.
Yeah. What's happening?
Teresa, if you want to call me on my cell and we can troubleshoot, I'm happy to do so.
mute button's not good, right?
What?
That mute button's not pushed, is it? That red.
It was on.
It's Mayday, Mayday.
Hi.
You read it. Do you need an agenda?
No, I just signed on through like I normally start the meetings. Yeah. Okay. So what's the email address again? Is it just Gilliam County Court? Or I didn't bring that stuff. Yeah, I'm there. Yep. No.
Guys, feel free to talk amongst yourselves.
Yeah, I know, I'm there. What? I don't remember the email address to sign on.
Feel free to talk amongst yourselves, but we'll reconvene when we're ready. There's nothing worse than having it not work when everybody's doing that. Like, oh my gosh, so stressful.
167 utility county.
Yeah.
Back in the day, utility regulation was declared as
There's quite a few people on.
Okay, and what was the password? I won't. I didn't like that.
She warms up after happy hour. You'll be way ready.
Yep, it's not liking it.
Right.
No, no, no. No, okay, so NOR. So we've got. No, it's not letting me sign in. Zoom.us sign in, right? That's where I'm supposed to be. Zoom.us sign in, that's where I'm supposed to be. Okay.
Today's the 29th. Burn ban's lifted as of Friday.
.us, yep, that's what I have.
So they said
AGC 2020. No, it's not letting me sign in.
They haven't given us statistics out. I didn't see any numbers, I just saw that they had declared an emergency.
What was that?
For what?
From the roundup. First thing morning, they said
But won't that disconnect everyone?
47 cases they knew of taking the roundup or not.
Yes.
Okay, so I just end just for me. I don't know where to do that. Just click on my name, or do I do it at the bottom, or participants, or I have no idea. Yeah, but that'll make everybody leave. Okay.
So Lisa, can you talk to us and see if it's coming through the speaker?
Can you hear me now?
Yeah, did you not talk so loud?
Yes, we can make it right.
Am I coming through the speaker or am I coming through your laptops?
The speaker.
Yay!
Loud and clear.
The only
Jeez.
thing I'm wondering, I don't see us actually coming up in the picture.
So if you turn the camera on to Owl Pro, Teresa, we should be able to see you guys. There you go.
Yeah, so everybody knows, this thing in the middle is a camera, and it will turn to whoever's speaking in the audience, so don't be alarmed if you see it moving, that is what it's doing, it's finding whoever's speaking, so that folks on YouTube/Zoom can see who's actually speaking.
So it just turned on this.
Yes, so it is on me. It's typically on me. What does that say?
We like that. Try not to sit this boat.
So before we go back to the Zoom, we had 2 more people come into the room here. And so Rita, do you want to start and introduce yourself? And then
I'm Rita Misiak, Arlington, Oregon, Richmond, Economy.
I'm Justin Davis from Arlington.
great. Okay, Shannon, take it away.
I would like to take my picture away. I can't get my video turned off so I can see myself. This is Shannon Topic, and I'm with South Gilliam County Ambulance Service.
Great. Margaret? Are you there? We had Margaret took on me too. Catherine?
Catherine Griner, City of Condon.
Cindy?
Cindy Hinton, South Gilliam Health District Board.
Lisa?
Lisa Atkin, Gilliam County Chief of Staff.
Mayor Buffton?
Mayor Buffton, City of Arlington.
Sabrina? She might just be listening.
Mhm.
Hey, Sabrina? Mary? We have some Gilliam County staff who are listening in. Shania? Steve?
Steve Schaefer, Gilliam County resident.
Great. Amy?
Amy Nation, Gilliam County Juvenile Director.
I see Port of Arlington. I'm not sure if that's Jeff or Kelly. Kelly, is that you on the Port of Arlington sign in? Or is that Jeff?
It's Kelly, sorry.
Okay. Steph?
Hi, my name's Stephanie McInich. I'm a North Gilliam resident and an EMT with North Gilliam Medic.
Got it. And Les? Star 6 to unmute yourself, Les.
That would be me. I'm down at Rock Creek, West Remark.
Okay, great. So before we get into public comments, I want to kick off and just start because I know there was some chatter on social media about what this meeting was actually about. And so I want to make sure that we're all clear on what we're actually talking about here. So show of hands on who thinks we're here to talk about the North and South Health Districts combining. Anybody? Anybody? Okay, this is what I'm glad to hear, is that is not what this discussion is about. The county court has no authority over the health districts. So if they all decide to combine, that's up to you guys. But that is not what the conversation is about today. The conversation that we are having is concerning public health. And so for those who are unfamiliar, I'm just going to give you sort of a really, really high level of what we're talking about. Is think about it in terms of like community health. So we're not talking about like when you go in and see your practitioner at one of the local clinics. We're talking about things like the person who comes out and inspects restaurants to make sure that they're sanitary. It's about prevention. So big sorts of things that are affecting the entire health of the community rather than individuals making healthcare decisions, if that makes sense. Currently, our public health services are provided through North Central Public Health, which is a partnership between Gilliam, Sherman, and Wasco counties. And so what the conversation is today is in March, the administrators for both the South and North Gilliam Health Districts, so Holly and Dave, came to the court and requested that we fund a feasibility study to look at whether it would be feasible to bring public health back into Gilliam. And so the purpose of today's meeting and sort of what you can expect is that we're going to talk about, I think there's some folks here who have some perspective who have worked with North Central Public Health who may have some insights to share. We're also going to sort of get a high level of what Daleen has been finding on the feasibility study. And then it really is honestly an opportunity for everybody around this table and in the audience to ask questions, raise initial concerns that you have, those sorts of things. Partly because what I'm hoping is that Aileen can take some of that, if your questions are not currently captured in the feasibility study, that's something then that may need further exploration that the feasibility study could include, if that makes sense. The other thing I want to make absolutely clear is that this is the first discussion. So the county court is not making a decision today. We will continue to be discussing it. So I don't want anybody to feel like this is a rushed thing or we're making a decision like this afternoon and you need to like, we're going to be polling people today on whether we should leave or not. That's not what this is about. It's about starting to raise or surface people's questions, concerns, and start a discussion. And also make sure that because public health is something that has not been within the county for quite some time, a lot of people, it's confusing on how public health fits into healthcare generally. And so a lot of times people confuse it with what our two health districts are doing. So I think this is also a good educational opportunity for folks to kind of understand how this works. So with that, I will go ahead and kick off with public comment. I will say that we are very informal here. And so my expectation is for folks in the public, like, we'll have a section for you, but if there's, as we move through, you want to interject, ask questions, things like that, if something that somebody around the table says that brings up another idea, feel free to participate as we move through the agenda. So with that, we'll do public comment. Commissioners, did you have anything?
Yeah, my question was, I don't think, from what I've heard, Gilliam County's never actually had a local health authority. They use the state for it. Is that true?
I think that is correct.
Okay, and then just for the audience, there's 36 counties in Oregon. 34 of them have their own local health authority. 3 of them, us, Washington County and Sherman, are the only joint county local health authority that's set up, and Wallowa County is doing what we used to do with state and territory.
So with that, anything from Sharon?
I do not.
Okay, so let's go into public comment. Individuals wishing to address the county court may do so at this time and at other times throughout the meeting. Speakers are asked to raise your hand to be recognized by the chair, give your name and address, and limit comments to 3 minutes. And again, as we go through, questions come up. I think we're informal enough. I think we can handle this. So does anybody have any initial from, we'll start with the audience and folks on Zoom. Go ahead.
Well, I'm Ava Kilkenny, and I'm glad you made this clear because I've listened to all these rumors. That's why I'm here today. I think the comments should have come after we heard what the study has found, findings of the study. Because how are we going to comment on something we haven't heard? Also, I'm glad it's not about what you said earlier. So I'm going to wait and maybe I will tune in later.
Perfect.
Thank you.
Yes. Any other comments initially from folks in the audience?
Yeah, Justin Davis from Arlington. Is there anywhere you can tell me that I can find the detailed information on what exactly was the investigation? More, you know, other than just saying, oh, well, we'll do our own health inspection for businesses and whatnot. I'm just curious as to what all we would start doing that we do as a tri-county or something like that.
Mm-hmm. So that, I think the feasibility study kind of details what, or my hope is, maybe Bailey can speak to this, that I have not seen the feasibility study, let me just put that on the table, but my assumption is that that will walk through what a public health department should be providing and how potentially those services could be provided. That makes sense. So the court is scheduled to meet, our regular meeting is next Wednesday, and we tentatively have the feasibility study scheduled to actually be able to see it for the first time and start to digest it. And so when we get that, all of that information goes on the court's website. So we'll have a link on there if folks want to actually go and read the feasibility study. But the court will be sort of diving into those details in terms of, so I don't have an answer for you at this point. There isn't a document. This is the very beginning of the discussion. Yes, yeah. Any other initial comments or questions to start? Shannon.
So I would like to just kind of share with you guys, and Liz, I know you're very well aware of this. When we first started into COVID last year, one of the things that we needed to do for our EMS personnel was to get them mask fit tested. We had a meeting with the person from public health and said, hey, we need to get this done. Do you have the ability to do this? And they said, oh, the only thing that we can do is you can come to the Dalles and you can learn how to run our mask fit tester. And then you can send all of your EMTs to the Dalles to get mask fit tested, which is not really good service, in my opinion, for what we were getting from them. And they said they couldn't move their mask fit tester around to help. As a fire services coordinator, I carted the mask fit tester that fire services had around Gilliam County for a number of years and was well aware that we could move our mask fit tester. We finally, after me being really frustrated with the whole situation, talked to Liz. I don't know what happened. They finally agreed to come and do the mask fit tests. Same exact mask fit tester that we use for our firefighters over the years. So here is a situation where I felt like public health should have been helping us, and we had to work really hard to get them to come do something that shouldn't have been that hard for them to do to start with. The other thing that I have experienced personally is for different occasions, you have to have maybe like a TB test is one of the things I think about particularly. And our clinics have not had the, whatever you call it, reagent or whatever that they use to do the test, but they could read the test. So in order to get a TB test done, we would have to go to the Dalles, get the skin prick in the Dalles, and then we could come back and have our people read it here. And I'm hoping that with this, it will give us more access to those kind of services in the county.
Great, thanks, Shannon. Anybody else on Zoom that has some initial comments or questions? Obviously, again, as we move through, I think we're open to that. So I wonder if maybe the place to start, I know that there's some folks around the room who have had people who are in the audience maybe wondering, why does this come up? Why are we even talking about this? And so I think it may be a benefit for those around the table who have some experience working with our current public health system to maybe share what those experiences are and why this even came about, why this is even a discussion that the board is considering. So I don't know if anybody on Zoom or anybody around the table wants to. I know we have some board members from public health, by the way. We are on that board as well. So I would open it up and see if anybody around the table wanted to start there.
My name is Danny Sperry. I'm a PA at the clinic. I've been there for about 3 years, and I've been on the North Central Public Health District Board for a couple now. So I don't get us wrong, right? I think NCPHC is a great public health department, but I think they're a great public health for Wasco County. I don't know about Sherman, but I don't think that we're getting the services that we need in Gilliam. So from a practitioner standpoint, I know we've had trouble with getting services for a couple of different things. Reproductive services has been a big one. Having women that need birth control that have to travel to, that, don't have access through insurance or, whatnot, that need it through the public health, that have to travel to the Dalles to do that. And for some that have difficulty with transportation or with, the whole situation, that haven't had good access to that thing. When I started a couple of years ago, that was something I wanted to try to incorporated. So we had discussed with public health. After a while, we were finally able to get their public health nurse to come out to the clinic to offer reproductive services like the next one on placement, that sort of thing. But it wasn't something they were willing to set up on a regular basis. It was something that we would have to like request, and when we requested, it was, you know, we'll get to it kind of when we can. So I mean, they made it work, but it again wasn't something that was readily accessible like our community members should have. And then, you know, similarly with immunizations and, you know, with COVID and there's been a lot of difficulties from that aspect as well, as far as, you know, the level of contact tracing in our community. I know we've had quite a few patients that said they never got contacted by the public health department whatsoever, that didn't know that there were resources available for people that had COVID that couldn't work, and that some miscommunication between, you know, advice that we were giving as practitioners that was what we understood to be giving, that they were getting different from the public health chart. So there's just been a lot of miscommunication and again, not necessarily great access to some of these things that people have to drive, and it shouldn't be that big of an issue. I don't think that they have to be able to drive quite that far. And so, you know, from the board standpoint, again, like I said, I think there's some really great people at North Central Public Health, and I think they do a whole lot. I think that Gilliam County gets kind of not necessarily front line, which is if we were able to have our own public health department, our focus would be on our communities and our community members' needs. We've asked a couple of times for specific numbers on, you know, the number of patients that they see from Gilliam County that they do reproductive, you know, services for, that they do whatnot for. I still haven't been able to see those yet. And so that's kind of one of those questions, again, where evidence to me that I think they do great work. I just don't know how well our community members are getting access to the services that they should.
Other folks that want to weigh in? Mike,
So I might get introduced earlier. I've been there now about 8 years and was on the board before Danny as kind of one of the county representatives for about 3 years before that. And it's really been since I've been there, and a little bit before I was there, that the clinic recognized that we didn't have a significant amount of support from North Central Public Health District. And I agree with Danny, having been on the board and having worked with them in that manner. Like they have great staff there, they have great facilities, they just have them in the Dalles, which for the majority of people in Condon and in Gilliam County is not something we just want to. From the very beginning, I think they come, I understand they come to North Gilliam County to do shots like twice a year, and they supply you and they charge you guys for that. I guess the school and the clinic. And if you lived in the Dalles, you could go, you know, just about any day of the week and get your shots. And that's the case anywhere there's a local public health district. I mean, I wasn't originally a Gilliam County resident. I moved here 9 years ago. Before that, my experience with local public health was always local public health. If you had the need to access their reproductive health clinic, you were able to go to that, any day of the week. You didn't have to call and try to schedule out weeks or months in advance, which is what Danny's talking about trying to do. For immunizations, like they were always available for things like STD clinics, which are part of what a public health should be able to provide or does provide. That's something you could walk in without everyone else knowing that you were going to the STD clinic. And so from the very beginning, we questioned whether or not our residents are even getting any services because of that distance. And I'd like to point out that we've asked North Central Public Health District multiple times over the past 9 years to give us any information about what services they actually provide us. And they've never been willing to or able to, which is disconcerting in itself, because that means they're not either serving any of us or they're not willing to say how many of us they're serving, which is probably a very low number. You know, the issues with COVID have been many, from the early on testing with lack of support for us being able to test early on. It was much easier early on to get a test. Even south of us in Fossil, which ran their own local public health, they had tests, immunizations, everything easily a month before us. They reached a vaccination limit of like 30 or 50% before we even had a week of vaccines out. And this is a small local public health, but their focus was able to be on them. And Wasco County is the biggest county, so North Central Public Health District has to focus on public health, which is a numbers issue. So for that was their focus. And that was plain and has been plain throughout COVID. So again, I think they're a great group. I think they've been, they've been good to talk to, and in some ways they have had great expertise. But as far as actually serving the county, I think it's important that there's probably very few, except for those that are on the county board or have worked directly with them in this room right now, that actually know what public health is and what they're supposed to offer. And I think that alone is a testament to how poor of a job they are doing.
Other insights from folks who have worked with public health? Chris has some stories, I think, some more stories.
I'm going to work this.
Good. Okay. Yeah. Lisa, you're up.
So my name is Lisa Helms, and I was newly elected to the South Gilliam Health District Board. But I also am in a unique position in that I have had an office in the South Gilliam Health Center for the last 13 years. And with my position with Community Counseling Solutions. And also because of my connection with Community Counseling Solutions, and our agency actually operates for local public health in Grant County. So I do have a little bit of understanding about what public health can do in local communities. And as well as our agency is in a lot of counties. We're in Morrow, Wheeler, Gilliam, in Grant right now, and moving into Umatilla County as we speak. So I think that my perception really is from what we could have here in Gilliam County. And I think that there's opportunities that we miss. Public health does tobacco prevention, suicide prevention, and I'm talking specifically about those communities where they have their local public health. They work with the schools on a regular basis, and we were talking about coming in and doing STD stuff, or lots of different education that we don't necessarily have here. I feel like in our county, there are organizations that sort of pick up the pieces and try to do some of those things. But again, I think that there are opportunities that are missed because we aren't public health. We don't have public health here. And at times it does tend to be a funding issue as well. We have in Morrow County, in Grant County, and in Wheeler County, there's school-based health centers there. That's an opportunity for health to come together. So mental health, physical health, and dental health. And that's all ran through public health, the public health departments. Gilliam County, we don't have that opportunity here unless North Central Public Health would come out here and do this. So I just think that my perspective really is a little bit different, just from the mental health side, and also as a board member for South Gilliam Health District, the board does support this idea, and it has been a conversation for much longer than what I've been on the board.
Chris?
So, yeah.
Where do you start?
Where do I start? So this is Chris Fitzsimmons, and I have been doing the Gilliam County Emergency Manager position for 28 years. And it started, and I can't even remember, I want to say 1999, maybe 2000. We didn't have public health. We were covered by the state. And it started out with the communicable disease and the bioterrorism plans that all of a sudden the federal government decided, oh crap, things are going on and everybody needs to get ready. And oh, by the way, this county doesn't have public health. So Wasco County, are you willing to take some of our state funding and do a plan for Gilliam County and include it in with Wasco, Sherman, and Gilliam County? So that's how I very first got introduced to public health in Wasco County. And at that time it was Wasco, Sherman. And I was just kind of the outsider coming in as emergency manager, dealing with the communicable disease and bioterrorism plans and stuff like that. So I actually started working with them way, way, way before they ever became NCPHD. So, and it was great. They had a public health emergency preparedness person down there in the Dalles, and we worked together and we got our pandemic influenza plans done, and we did our mass fatalities plans. And this is all part of emergency management that public health should be doing. And then when they did such a good job with that, then the state comes to them and says, hey, you guys want some more of our funding? And, we're going to, start sending you some more money if you're going to take on more stuff for Gilliam County. So eventually, they started taking on a little bit more and a little bit more, and to the point of where, they were doing a lot more. So eventually, it came to that, the Terry Tulliver actually, let me back up a little bit. First, let's go back to the Laura Pryor days of Gilliam County Judge. Her and myself and Kathy Schwartz, who was the director of Wasco Sherman Public Health at the time, they decided that they wanted to get together with Wheeler County and find out about what Wheeler County thought about maybe joining up and maybe doing a small public health. Well, that never came to fruition. So everything kind of went away. And I just continued doing what I was doing with Wasco Sherman Public Health, and the state part of it still continued to cover Gilliam County. Then in 2005, was it when the county court finally signed on with, it became NCPHD? 2009. They signed on and became NCPHD. So again, there was little things going on. I participate in the public health emergency preparedness meetings. I participate in what's called a hospital preparedness program with them down there, and they were bringing in some more trainings, and I was sending it off to EMS and the fire departments and said, hey, there's these trainings, but these trainings are all in the Dalles. And at the very beginning, they were rotating the meetings between the three counties. And then when we decided to do both meetings at the same day, we just stuck them in the Dalles and in Wasco County. So time goes by, and what we knew back in creating the pandemic influenza plan, if we only knew then what we know now, so COVID hit, and I will tell you, I have never, ever in my life been so freaking frustrated with something in my life, and I've been doing this for 28 years, and was so frustrated. Part of the issue is when the state sends stuff to NCPHD, they send stuff to them as one public health department, regardless if they're covering three counties. Fossil has Asher Clinic, which is Wheeler County. So when they started receiving vaccinations for COVID, they were receiving 100 vaccinations each time they got a shipment. NCPHD was receiving 100 vaccinations each time they got a shipment. So guess who got 10? Gilliam County, Sherman County. Wasco County got 80 of the 100 when they first started. That's because of population. Well, if we had our own public health department, we would at least get the minimum, which would have been 100, a shipment just for Gilliam County. I have been in contact with the regional COVID coordinator from the state of Oregon, the OHA, and she said, yeah, it's really hard to gauge when the state does not see that there's three counties in that district, and they're not sending you 300 vaccinations. So that was very frustrating. I tell you what, I went to the judge and I said, we have got to do something, to the point of contacting the governor's office at times, because it was very, very frustrating. And what frustrated me more than anything is the community members that were getting very, very pissed off because they could go to Fossil and get a shot a month earlier than what we ever started giving here in Gilliam County. There was well over 125 people from Gilliam County that went to Folsom were vaccinated before we even started in Gilliam County. So that's just that's just on the vaccination side. And back to Shannon, when she was talking about the fit testing, that was a very, that was a situation that we finally got taken care of. But NCPHD didn't bring that, they didn't bring that fit test machine out. It was the Wasco County Emergency Manager. He's the one that brought it out from the Dalles to Gilliam County for me to get all of the EMS, fire, law enforcement, PAs, anybody else from the clinics to get fit tested. It was the Wasco County Emergency Manager that brought that out to Gilliam County for us on a Saturday. Wasn't public health. So you can tell my frustration. There's lots and lots more stories where it goes. I mean, it's you know, we thought, oh, last year, you know, after everybody started getting vaccinated, things were going to kind of simmer out a little bit, and then boom, here hits the Delta variant. And so now it, you know, kind of started all over again. And now it's not so much about the vaccinations, but about the testing. That, you know, we've got to have people out here that are doing testing. We had pretty much all the school closed down in Concord for the last 2 weeks. The high school still doesn't open again for everybody until Monday. We had a childcare incident. Summit Springs, our assisted living facility, had an outbreak of 3 of their caregivers up there, and ended up with 4 of the residents testing positive as well. And we have just been fighting with everything. But again, like I said, the NCPHD can only do so much that OHA allows them to do, but still it's, you know, and what's frustrating me more than anything is they call us and say, oh yeah, well, all of your residents that are above 65 that are eligible for vaccinations, they can get on the list and they can go to the Dalles and get their vaccination done in the Dalles. Well, number one, they're older than 65. Most of them don't drive out of the community. And now you're telling us we have to put them all on a bus and send them to the Dalles for vaccinations. So it was not it wasn't feasible for Gilliam County residents. And it wasn't a good choice at the time. And other than that, I mean, there's all sorts of stuff, and I'll let Liz, or I'll let Damien talk about the feasibility study that she found out about some of the stuff and answer any questions later. So
I will say to folks who are listening, I mean, I want to give huge kudos to Chris, because I don't think folks recognize how much she goes to bat, because it is literally every day advocating for resources, whatever the districts need that they're not getting from public health. It is typically Chris on the phone with people saying, where is my vaccine? And if she, I mean, people pick up the phone because it's Chris. But if she hits roadblocks, it's like, you don't want as judge to have to call the governor's office in order to get your public health district to do what it needs to do. And I have to say that I have had to do that in order to get them to respond in the middle of a pandemic. So that's where the frustration, I think, is coming from, is that Chris has a day job, and keeping North Central Public Health doing what it needs to do here isn't really, she has other things she needs to do as well. So I just want to put that out there as a kudos. Like, if you haven't thanked Chris Fitzsimmons recently, you should be thanking her, because we would have been in a whole world of hurt if we had not had her 28 years of experience over the last 18+ months. So thank you. So with that, are there folks on Zoom who have any feedback of this sort or any other experience? I know there may be some folks who have some different experience, and I see Steve, you unmuted. You want to comment?
I did, Judge. So when I was sworn in January of 2013.
We can't hear you, Steve. I'm sorry.
Am I not muted? Unmuted?
You're I think you might be a little bit far away from your mic, maybe?
Okay, all right.
There
I'll
you
try
go.
to get a little closer. Is this okay?
No, a little bit closer.
I'm as close as I can get.
There, that's better.
Okay, I'll try. I'll speak loudly. Somebody had mentioned that NCPHD started in 2009. I thought when I first came in 2013, NCPHD, we were still working on things like, what was going to be the value of the in-kind costs for Wasco County. There was some discussion about, okay, the cost per individual that they pay, that's cash out of their pocket, what we pay. A lot of that was offset by the in-kind cost and using of Wasco County buildings. I'm trying to, I thought that the agreement that these three counties had began in sometime in 2012. Correct me if I'm wrong. Who said 2009? Maybe they have a lot more knowledge than I have.
Yeah, and I believe I specifically asked you, Liz. I did go to Liz just to double check because I had heard varying numbers.
Yeah, I sent
and
it to
days,
Daleen.
but 2009, we were able to find the paperwork on that. And when we joined NCPHD, it was in 2009.
It was
In
Pat Shaw.
2009, okay.
Pat
Yeah,
Shaw,
yeah,
Mike
Pat-
Weimer told me
Pat
it was
Shaw.
Pat.
Yeah, Pat Shaw and Mike Weiner signed it.
Right. I know that Judge Shaw was quite involved with it. So that's all I had. I'm really excited to listen to the work that you've done.
Great. Anybody else on Zoom that has initial comments? Again, as we go through, this is not like a speak now or forever hold your peace kind of thing. This is the beginning of the conversation. So, Pat, did you have something?
Yeah, I'm on the board too as the commissioner from Gilliam County that's on the North Central Public Health District Board. And I agree, they've got great people. They do a great job for Wasco County. The problem is, and I've had some discussions with Joan from Sherman County, who's also on the board for Sherman County, and they don't feel quite like Gilliam County does. And I really think the bottom line is it gets down to mileage, period, man. They do great in Wasco County, do a little better in Sherman County, they don't do as good for us. And I don't know if you ever get over that hurdle. I do know that there's some discussion that they're trying to hire a liaison in Gilliam County to tie that knot. I don't know much about that. It sounds like they're concerned of losing Gilliam County, obviously, but I don't know the hurdle of the mileage is something you can overcome no matter what you do.
Great. So go ahead.
No, I was just going to speak about what happened to us partially also is the public health director, when we started the COVID, God, how many years are we doing this now? A year and a half ago?
Yeah, March
In
of
June
2020.
June 30th of 2020 is when Terry Tolliver retired. And so we got an interim director came in at the time for NCPHD. And I will say that I have learned more about public health than I ever thought I'd ever need to know. And I will say also that the federal government didn't do us any favors in the logistic nightmare that they created by putting 10 doses in each vial. And by God, you better use all of them. You open one vial, you have to use it within 6 hours. You have to have it in somebody's arm and you can't travel with it. I mean, on and on and on and on. The logistics were horrible. And, but August of this year, NCPHD, well, actually it was even sooner than that, this spring, they actually decided to appoint Martha McGinnis as a liaison to Gilliam County from North Central Public Health. And she's more or less a planner for at a local level. And when we met with her in August, I finally told her, I said, it would have been great if we'd had somebody with boots on the ground 18 months ago when this started. Because I said, I have done more about public health in the last 18 months than I ever thought I ever would. And it would have been nice to have that liaison here then. Well, they decided to take that idea and run with it. And so that's where that liaison, that's where that has come from. Shelley Campbell has called me and asked some questions, ran down a really quick job description as much as she could for a temporary position. And I think they're advertising. So that's the last idea.
Okay, so with that, I mean, I think again, the feasibility study is not final. So I just want to put that on the table. The court has not seen it. So we are just sort of, I think, hoping to hear kind of a high level from Holly and Daisy about what they're finding so far, what we can expect. Maybe give us a preview of what the court will see on Wednesday, which is next week. And again, for those who missed it, this is scheduled for October 6th for us to actually review the actual study, and that will be on the court's website. So folks will be able to access that and read it for themselves if they want to read it. So I'll turn over to you, Holly.
Okay. As you know, my name is Holly Winslow, and I have worked for South Gilliam Health District since July of 2009. I'm currently the administrator at South Gilliam Health Center, and I'd like to thank the county board for organizing this work session. According to Pat Shaw, in 2009, when Gilliam County entered into an agreement with NCPHD to provide public health services, neither clinic was interested in taking on that role. Times have changed, and we believe bringing in the local public health to Gilliam County is the best option to better serve our community. From 2010 to 2013, during the day-to-day operation of our clinic, there were times when we would call on North Central Public Health District for assistance. Back then, we assumed that certain issues should be handled by NCPHD. After several incidences of not getting the help we expected, we began to question if we were even addressing the right entity. So the inquiries began. As time went on, we self-educated ourselves about what public health actually is. In the fall of 2013, after consulting with the county judge at the time, we hired a consultant to research public health and what NCPHD was doing in our county. Although this research was enlightening, no further action could be taken. As time went on, there were more occurrences of inadequate health and, of course, more questions amongst our staff. Our providers also acknowledged certain services that our patients needed and were not able to get because they could not travel to the Dalles. Our frustration certainly intensified when the pandemic began, as it did for a lot of people. After holding on to this idea for years, we took another chance by contacting the current court members. We appreciated the fact that they were willing to listen to us and have an open mind. The county court agreed to support a feasibility study. At that time, Daleen Wilson was hired to conduct the study. The South Gilliam County Health District Board and the staff of South Gilliam Health Center truly believe we are very capable of running a countywide public health department. More importantly, we are ready and willing to take on the endeavor. That is a very brief history of how we got to this point. You're about to hear a lot of information. The bottom line is Gilliam County is not getting the public health services that every Gilliam County citizen deserves. Turn it over to Daleen.
Go ahead, Daleen.
All right. Well, I appreciate everybody coming here today and tuning in to listen to what we have been working on for the past 6 months. Again, I'm Daleen Wilson. I grew up in the Condon community and I graduated from Condon High School. I won't say how long ago.
1 year before me.
And then I ended up over in Milwaukee, Wisconsin. I went to college at Marquette University, where I graduated with a bachelor's degree in health sciences with a focus in dental hygiene. After many years of being in the Portland and Hillsborough area, my family moved back to Condon last year once COVID hit. And our drive was that I really wanted my kids back in school. I didn't want them doing school with me at home. So there's a lot of motivation there. But we have been really, really excited to be back home and play an active role in our community and give our boys the opportunity to grow up in a great community just like we did. I'll give you guys a heads up front. I really am not very great at public speaking, so please be patient with me. I will be referring to my handy notes here a lot.
just to keep myself on track. But my job here today is basically to explain to all of you about public health, and through everybody's comments, you've already learned a ton. And I can assure you that there seems to be like a never-ending abyss of information that you can find. So my goal in kind of going through this is to not get caught up in all the little things. I want to give you kind of very broad spectrum overview. And then once I'm done, if you have specific questions on what certain things might entail, I'm happy to get into it more thoroughly. But I could literally sit here for 2 hours and talk and tell you about all sorts of things, and I'm sure nobody wants to be here that long. So public health, it's here, it uses organized measures. Again, we're promoting health, we're preventing disease, and we're working to prolong the life in our community. And when I say community, and I'm going to use that term a lot, I mean Gilliam County as a whole. Public health is here to focus on the entire population and not just individuals. But it's also in place to help ensure access to healthcare needs for parents and their children. So that's very broad spectrum. I'm going to break it down a little bit more into like the state level and then the local level as well. So at the state level, public health is run through the Oregon Health Authority Public Health Department. And then it's made up of state public health, local public health, tribes, and then other entities. And then for our purposes for this study, we strictly focused on the state level, and the local level, we didn't meddle into anything else, just because it doesn't pertain to us. As Pat said earlier, almost all of Oregon's 36 counties run their own local public health authority, with 2 exceptions, and one of that is the Public Health District, and that includes our 3 counties, so Gilliam, Sherman, and Wasco counties. And the other exception is Wallowa County. Again, as Pat said, it is run by the state. If there's any questions at the local level, the Public Health Authority reaches out to the state level, and they're consulted and brought in, and they help as necessary. So the state is always there to help anybody out at the local level. At the local level, we call those local public health authorities or departments, and they are seen as a county government. And there are certain programs and functions that a local public health authority has to provide and is mandated by Oregon revised statutes and Oregon administrative rules. And those programs are communicable disease program, environmental health program, programs for the prevention of injury and disease and the promotion of health, clinical preventative services, and emergency preparedness. Out of those programs, there is a lot more detail that goes into each of those. And that's one of those holes just right now that I don't really want to fall into. But we can come back to it anytime if you want to hear more about that. We can pull those up. There are various ways to run a local public health authority. Every county does it a little bit differently. It's not one size fits all. And that's really good news for Gilliam County because we can tailor it to the needs of our community. We can make it what we see fit and what we see the need for. As I stated just a bit ago, there's certain programs that have to be in place and offered, but beyond those mandated programs, there are also many other programs available that each local public health authority can opt into if they see the need. Lisa touched on a couple of those, alcohol prevention, tobacco prevention, things like that. But these are called program elements. So even the mandated ones and the optional ones, we call those program elements. And the program elements are important because they are essentially how the state funds and pays each local public health authority. And it's based on considerations of things like the population size, the burden of disease, the overall health status of the community or the county, and the ability of each local public health authority to invest in their activities and services. In addition to that state funding, the state also asks each county to contribute funds to its public health department. They want everybody to have a little skin in the game. And that amount varies greatly depending on the county. There's no set amount that anybody has to contribute. It's at the county's own discretion and basically based on the funds that that county has. So on the data that we got from the Oregon Health Authority, and it was for the 2018 year, that is the most recent data that the Oregon Health Authority has available to anybody. They haven't put 2019, 20, we don't have any data beyond this. But that range, and I'll say that the range is per capita, it's broken down per capita, but that range is anywhere from $3.50 per capita all the way up to $71 per capita. Gilliam County, interestingly enough, comes in third highest with our contribution to North Central Public Health at $64 per capita, which is about 3 times the amount of what Wasco County contributes at $19 per capita. The average per county for the whole state is about $17 per capita. We've talked about overall setup, some funding. I want to go a little bit into staffing. Again, here with the staffing, there's ORS and OAR rules set in place about employing certain personnel, and at a bare minimum, a local public health authority has to employ a health officer and an administrator. The health officer has to be a licensed physician, and some of their duties would include providing medical direction and consultation, reviewing and signing orders or protocols, and just providing medical guidance during outbreaks. The administrator is somebody who supervises the activities and the programs of the local public health authority. And in appointing both of those roles, the OHA must be notified, as well as submit the resumes of those two persons too. Oftentimes, due to staffing limitations, many counties will utilize the option to contract out certain services or programs. A common example of this is the environmental health program, is that there are just not very many environmental health specialists out there, especially in Eastern Oregon. You see, I thumbed through the list, there's a handful in Eastern Oregon, there's a whole lot more on the west side of the state. But this means that the contracted entity would perform the actual service, like restaurant inspections, but ultimately the local public health authority has to perform the governing function, which is actually issuing the license, or sometimes it's a civil penalty. The contracted entity doesn't do that piece. They just do the service, yes. And this is something that we would foresee the need for in Gilliam County. I'd like to move on to our current position with North Central Public Health. Some of this is going to seem redundant. You've heard a lot from everybody else, but I'm still just going to toss it in there. Gilliam County has been with North Central Public Health since 2009, which is 12 years. In our many conversations, interviews, questionnaires that we have sent out into our community, and these are conversations with people that would work really closely with North Central Public Health. The overwhelming response is that they have not seen a presence from North Central Public Health in the Gilliam County for quite some time. For the few services that we do
see more of, like WIC or inspections. Many have expressed that they feel like it's just not sufficient or enough. Feedback from the Arlington clinic specifically, they use North Central Public Health twice a year for vaccination clinics. However, they have to pay an additional fee to get North Central to come to them to provide those vaccinations. In our opinion, we already pay North Central a good amount of money, and this is one of those services that is mandated by the state, and we feel like North Central should be providing it to us anyway without any additional cost. That should be part of what they're doing. It's also been expressed, as you heard, especially from Mike and Danny, that it can be difficult to get through North Central Public Health when services or help is needed in Gilliam County. It's not easy anyway to go about it, trying to get them on the phone, whatever it may be. Gilliam County is the furthest away from North Central Public Health based in the Dalles out of the 3 counties. And frankly, it's just not close enough in proximity for them to see the needs of our community here in Gilliam County. We did reach out to North Central with very specific questions regarding the services that they give to Gilliam County specifically. And unfortunately, we were told, and I quote, "We are not at this time able to get you this information." It's a bummer. We have a lot of questions and that would really help this study too, but unfortunately, I just don't think we're going to get it at any time. With the Gilliam County contribution and the state contribution on behalf of Gilliam County, we believe we should be getting more services and seeing more of a presence in our county for North Central Public Health District. I'd like to shift to the idea of a Gilliam County Local Public Health Authority now. The budget that was created and that we'll be submitting to the county courts is partly based off the numbers and the funds that Wheeler County gets from the state, and we use Wheeler County as a model because they are the closest thing that we have to estimate numbers from. We asked the state to give us a breakdown of what the contribution would be county by county for the Tri-County, but unfortunately they cannot do that. They don't do that at all. They don't break it down. So that number is not available at all. It's highly likely that Gilliam County would get more funds than Wheeler County simply because we have a higher population. Based off of these numbers and what Wheeler County is able to function with, we see no reason why Gilliam County could not run their own local public health department. It's going to be essential to involve as many community members and agencies as possible to run a successful public health department. And not only do we need these partners, but communication between everybody is going to be vital to make sure that we're running the best health department that we possibly can. In our opinion, the local agencies that we think would be valuable to include, and here's a little list for you. We've got North and South Health Districts, the North and South Clinics, North and South Ambulance Services, North and South Fire Districts, cities, schools, child care facilities, community counseling solutions, Gilliam County Sheriff's Office, Gilliam County Emergency Management, Gilliam County Family Services, Gilliam County Transportation, Murray's Pharmacy, and the Department of Human Services. In addition to the partnership with those agencies, collaboration within all areas of our county would be crucial to help increase knowledge on our community's health needs and help guide the local public health authority to provide the best services possible. And the best way to ensure this collaboration is to form an advisory board And we would want to have input from people who are committed to the overall health of our community on that advisory board. And we would recommend representation from the North Gilliam County Health District, the South Gilliam County Health District, Arlington Medical Center, the South Gilliam County Medical Center, the Arlington School District, the Condon School District, Gilliam County Emergency Management, Community Counseling Solutions, and Gilliam County Family Services. So why is now the time for Gilliam County to start our own local public health authority? We're here, we have direct sight into our community and to its needs. And local communities are best positioned to make those determinations and measure those outcomes. We'll have better accessibility to services. We'll be able to create local jobs within our county. We'll be able to keep Gilliam County money in Gilliam County. We can better utilize our existing agencies to coordinate and provide a more holistic approach for Gilliam County. We have members now in our community that are ready to do it. We didn't before, but we do now. And the local resources that we have working together, they can deliver a more efficient and effective service. We truly, truly believe that Gilliam County is capable of running its own local public health department more successfully and efficiently at no additional cost to the taxpayers. Ultimately, in the many reports that we've seen and read from the Oregon Health Authority, they say many times over that local sight and control is best. Local, local, local. And we truly believe that it's best for Gilliam County too. We live within our community, we directly see the needs of our people, and we are best situated to provide the best that our community deserves.
Questions for Damon commissioners first before we
Yeah,
go to
when you were talking about per capita cost,
yeah.
would you take me, where's that money come from? Where's that money? We had this conversation before and it was 7,164 and I'm trying to.
Yeah. I have it. So those figures come from the Oregon Health Authority, county by county, and so they have a list, a budget. I don't know what you want to call this, Holly, but it shows each county's contribution.
So if they can't tell us, when you say contribution, what is the contribution? I mean, is that?
How much the county court gives to the public health.
North
Yeah.
Central, that's
Yeah.
138,000.
Yes. Yeah.
That's what I'm trying to get to. That, because it didn't make sense that they would have that number, but they can't tell us how much.
No, this didn't come from North
Okay,
Central.
this is just the money that Gilliam County budgets for North Central for what they do for us.
It's what every county does. This list shows every county.
Does that answer your question?
Commissioners, other questions for Damon before we go to the public?
I don't think my questions are, I don't think we're ready for my questions yet.
Okay.
But that's a little farther down than mine.
All right, public. I saw a lot of people like big eyes on some of the things Damon was talking about. Go ahead into that.
Will that report actually kind of give us a breakdown of how they are using that fund for each county, or is it safe to say, like Chris said earlier, they got 100 vaccines and then said, well, you guys only get 10. Would it be safe to say that probably do the same thing to us?
Yeah.
So those are the numbers that I've been asking for from the board, and I know that multiple people have asked for too, and they can't give us a breakdown of even just the number of residents that they see from Gilliam County, let alone the amount of money that they spend in our county.
So we sent out a specific letter to North Central Public Health asking them those exact questions. What are you doing? What programs are you running here? And what agencies are you working with? So it's very really specific.
So we never got a response, but that, Daily, when she talked to different community members, according to them, it was, next to nothing. So between those two factors, you just kind of have to make your own assumption, that we're really not getting much.
From the general kind of consensus of what's being said, I'm gonna get the conclusion that any money spent on us is sitting there waiting for us if we want to go there and use their facility. That's kind of what I'm getting.
The one thing that I would say, and this is, I get this real clear from this group, is they expect these services to be provided, period, and no questions asked. North Central's feeling or place is they get the money and they get what they get. They do what they do, and if we're not happy, why don't you tell us what you need?
Well, see,
And
that's
they want
my
us to ask
problem.
for it, and that's
Yeah.
kind of where they're coming from versus what's going on.
Yeah.
And that's
We shouldn't have to ask.
Exactly.
Well, and
It should be automatic.
I think that the general public doesn't necessarily understand what public health or what we're supposed to ask for. I mean, I think that,
I agree.
and I also think that what happened unfortunately through the pandemic was that the clinics, the North and South clinics, were looked at as, you guys need to do something. You need to give us vaccines. You need to give us tests. And the general public doesn't understand that this kind of thing really is a public health responsibility. And so I think, that's the problem. People don't understand what we should be getting or what we should be asking for.
So we have a, Cindy Hinton has a hand raised. Cindy, you got a comment?
Yes, can you hear me okay?
Yes, go for it.
Okay, I just want to go back a little bit to that list of participating partners and wondering if, for example, Summit Springs, and I believe there's an assisted living in Arlington as well, as those are people that maybe should come on board as initial people putting some input in that process. So that was my comment.
Thank you.
Yeah, I
I
would
thought
say
the
that
same
we do
thing.
not have an assisted living in Arlington. We have a senior living facility.
Senior services is what I was thinking, that, we do have a Gilliam County Senior Services person, so the seniors, which, she knows the senior meal sites, and she knows a lot of the seniors that aren't in the assisted living facilities and deals with them as well. So the senior service director, or whatever her title is, would be
That's a great addition.
Sabrina. Yeah.
Mike, go ahead.
Something I would say, pertaining to what you had said and what Danny had said is, the numbers we've asked for, they really treat them like they're some complex thing. I could tell you tomorrow how many people we've seen in the clinic from Arlington, from Fossil, from Spray, because any modern EHR has the ability to search for patients and for visits by zip code. It's a simple thing that if they wanted to give us that information, either they're not a modernized public health, which they say they are. They say they run a very modern public health up there
And got funding.
and have done funding for modernization, or they're just unwilling to give us information that helps us to make decisions.
Shannon, I have Shannon on, you're next.
Okay, so in talking about the health officer that needs to be overseeing that, can that be one of the doctors that's already working with our clinics?
Yes, it's any licensed physician.
Okay. And then the other question I had, and I think maybe it was covered a little bit, but I had a little hard time hearing. It sounds like we don't know how much funding the state would provide to us. Is that correct?
Correct.
Okay.
Yeah, I've asked directly for that, thinking that they probably have a breakdown between the counties of what they provide for each county for the North Central Public Health, and they don't break it down, and they won't break it down and give us those numbers until we're actually an entity. And that's why we have been using Wheeler County numbers as a model. Wheeler County was super, super kind to open themselves up to us and show us a lot of information so that we could at least get some very bottom line numbers in there and know what we could potentially be dealing with.
Do all those funds go through OHA to the local
Yes.
health authority?
Yeah.
And we
So-
decided to go to their statistics and say, this is how many people from Gilliam County we have served.
Yeah.
Somebody listed 125.
Right.
That was for vaccination.
So why can't?
They did, well, that's the alert system. That is a system, and you guys, that they have to put vaccinations into. And so that's their public health director in Wheeler County was able to go into that alert system and pull it out by zip code. And she was able to tell me how many vaccinations they had given that were 97823s and 97812s over in Fossil.
Before we go here, Shannon, did you have anything else?
No, I think those were the only two at this point.
Okay, over here.
Okay, I understood that the funding that you're talking about with Wheeler and Gilliam and using this comparative analysis also has to do with the wealth of the county itself. Is that correct?
No.
So when you did that,
Population, the county contribution.
yeah,
What the county chooses to contribute to their own local
but it's
public
kind of like
health.
the per capita wealth or whatever it is.
Yeah, but each county decides what they want to contribute to the public health. So we have not used that Wheeler County's number as part of that. We are continuing to use the number that we would normally give to North Central Public Health and put that in as the getting fund contribution.
I don't know where that fund started, where that budget line started, but it's a 3% increase each year. It went from about 134,000 to 138,000 from 2020 to 2021.
I think your question though, wasn't it, is the state's money coming in based on how
No,
much?
so my question
that-
was, if the county's fund, their portion of the funding, is it based from, the state bases that on what the wealth of that county is, or what the per capita wealth? That's what I kind of heard in your.
No, so the state bases their funds, it's based on their population size, is a big one. So they've got, per program out there, they have a set amount of money for each program, and that is all broken up between all the local health authorities. And it is, how do I better explain this, Polly?
Well, they're trying to keep it simple. There's two pots of money that go into every local public health department. One is from the state, and that is determined some of what programs you're going to do for your county. That's what that's based on. Not everyone gets the same amount. Then the other pot is every county contributes to public health, and that's their choice how much. Like Wheeler County, I want to say theirs is $2,000 or $4,000 per year. That's all they can afford. That's all the investment they put. And then we, Gilliam County, put $138,000, I believe. So we have all the figures of every county that they contribute. So the amount that county contributes themselves is totally up to the county. There's no mandated amount. So who
Except that-
volunteered us for third highest?
Well, whatever was negotiated with North Central, that's why that number's there, and that's our budget number. That was agreed upon within a contract.
That was my question, is why is that number so high? And the only thing that I can see that is a relative comparison is Wheeler doesn't pay much because their county residents per capita is a hell of a lot less than what we have in Gilliam County. And we have SIP money, we have all kinds of other things. So they look at the wealth of the county and they say to themselves, these guys need to pay more because they have more. That's the way it looks to me. Otherwise, why did we volunteer to do that?
Well, it was a way at the time that they decided to run public health for Gilliam County. It was an option, and that was the agreement they made with, basically with Wasco County initially, that became North Central Public Health, and Sherman County contributes what they contribute, which is the same as us. And we contribute, I think it's 15% of
So North Central either told us that what we had to pay.
It was an agreement between,
an
an agreement between the three counties.
Yeah, so,
Why, who decided to pay that amount of money?
but to be clear, the state doesn't require, so when they signed, and I haven't looked at the IGA recently, but I can speak to like the Quorum ones, typically when we do these regional partnerships. When, I think it was Judge Shaw was, been the one that this was under, and so when they signed it, they would have said, okay, say the budget is $100,000. Gilliam County promises to pay 15%, Sherman promises to pay 15%, Wasco picks up the rest. So when they originally signed it, that would have been based on whatever the budget was. But the problem with that kind of an agreement is as the budget grows, and we're only a third of the voice on there, we're committed to the percentage, not the amount. That makes sense, right? So Gilliam County signed on the dotted line and said, "Go keep 15% of your budget." And so that means that how that looks from the county's perspective, because Pat sits on the board for us, is when we get into budget season, is Pat will come back to us and say, okay, here's what the budget looks like at this more central, and how much we're going to need to budget at the county based on our contractual obligation to pay the 15% or whatever it is. That's how we set up Norcor as well. It's a similar system where each of the counties commit to a percentage up front. And then the board that's sitting over there is determining what that budget is, and then they tell us. And frankly, they can do that, I think, to your point, because Sherman and Gilliam are very, I always tell people, we punch above our weight because we have resources that most counties our size cannot bring to the table.
That was my point.
And I think Wasco County knows that. And I know that previous board members have had to have some tough discussions with Wasco County, who sees whenever they want to raise their budget over there and hire more nurses or whatever, that, hey, maybe Gilliam County could pay a little bit more.
Does the state then look through the same lens?
No.
When they fund, or is that just one person is so many dollars? Is that how it works?
So that I don't know. That would be Dalene's area on how the state actually, but I assume it's by program area, and they probably do, a lot of times the states will do a base and then they do a per capita on top of that.
But there were no conditions as far as level of services, level of care that Gilliam and Sherman would get for our big bucks.
Right, and no reporting. There was time they do not report to, they don't come to that county court every year and say, here's all the programs we ran, here's the metrics we're using to see if they were successful.
You can't get an answer.
No.
Right.
And that's why when you talk about 138,000, that's why they're concerned for what?
So I have a question for, when you're talking about the state funds programs, right? Okay, so are there programs that are mandated under public health?
Yes.
Sure.
Okay, so then to give you more money if you do more programs that are what are mandated?
Yes.
Okay.
Yeah, it
Got
just
it.
depends. And then that would go back to assessing the communities and what do they need. And then we would go look at the program elements. And then they're very specific. The state has guidelines and tells you what you have to do within each program element. And there are elements that you don't probably get any money for, but they might be something that we need. And so the benefit would be using the resources from the state to help you implement that program.
So the one thing that we haven't talked about that I thought was part of isn't the drinking water testing and
Yes,
swimming pools inspections and stuff?
Septic systems,
Okay.
pool inspections,
Yeah.
hotel
Okay.
inspections.
That's what I was thinking that was a part of that too.
15% forever, is this in stone?
No,
There's a deadline.
there is a deadline, and actually, when it was signed and agreed to in 2009, in 2014, was it maybe? 12 or 14, they agreed that every year, unless one of the parties chose to pull out, that it would renew the contract, the IGA would. So, and then you have to give 180 days notice if you're going to pull out. Well, that's good.
There's your bargaining chip. Like, you keep paying. Why did we say we could pull out or you reduce our fee?
Or give us services.
Service.
Or give us services.
Yeah,
Right.
and that's definitely the option, but it goes back to that statement of
yes, maybe we can get them to start doing some services, but that distance.
It doesn't get over,
Yeah.
it doesn't get over the mileage.
Cody.
Cody Davenport, South Gilman Health District. I think in talking with Leah Shannon and Catherine Greiner and several other community people, I think my biggest thing is I know Arlington, I know Condon. We're making a big push to make our communities more attractive, more livable. We want people to come live here. We're working on housing. We're working on, this is one of those blocks that people are going to look at. Why can my kids get vaccinated at school in Portland and I can't have it in Condon? Those are things that people are going to look at livability wise to come here. And if we can provide a better service to our community and make our community more livable, we attract more people. We attract more dollars. Those are basic, simple mathematics. And why? Why send our people out of the community to get a service that we should be able to provide right here in either Condon or Arlington? I mean, I think that is a crucial livability piece if we want to move our communities ahead.
Don't we feel it's our duty to provide those services and we're not
Yes.
doing that?
Yes.
Rita?
When we were in school, we had county health nurse that came to Arlington's grade school and high school and Condon grade school and high school. They gave the shots. Mary Weatherall was our county health nurse. And they sent out notes to our parents and our inoculation were due. And Mary kept track of every student's inoculations, month, day, year they were given, and she knew when it was time. She never failed. They even had vaccinations down in the play shed, health room, the same down here, and she even gave measles shots or mumps shots at her house. If you couldn't get in, she'd do it at her house. Can't we get back to that again if we go into the?
That's what we're trying to do. Exactly one of the points that we're trying to make.
And everything was kept current. I mean, and you know, I had x-rays at the clinic, you know, that, and a lot of stuff that I remember.
Let me just make sure, is there anybody on the Zoom platform who has a question or comment? Obviously, it's a lot to take in. So again, I will reiterate that this is one of the first discussions. So the conversation is going to continue next week when we hear the full sort of study and get to review it. And I'm sure there will be additional meetings, but any initial thoughts, feedback that folks have on Zoom to start with, and then we'll go back into this room. Anybody? Star 6 to unmute yourself. By the way, because I see Les is on here, I want to also just note for the record that Les Ruark did send in some comments just regarding sort of next steps and sort of what the process would be. That'll be part of the court packet. So if folks want to see that, Les, sorry, I forgot to mention that, but I see that you're on there. I don't know if you want to add onto your email.
It's on there now, Judge.
Okay, so it is up on the website already. Any interest, Les? I see you unmuted. Hey, Les. You there? Maybe not.
I think he did.
You unmuted. Hey, Les. We'll come back to you. Interrupt us. Anybody else in the room have questions, comments? Go ahead.
Is that better?
Oh yeah. Les, we'll go to you first and then we'll come back to the room. Did you have a comment, question, follow-up?
Yeah, I don't have anything to add to the record that you alluded to just a few minutes ago. Essentially, I just was encouraging the court to make sure that we do the best job of record building that we can I would like to throw out a wild suggestion though, and that's basically that maybe it's time for someone to put together a good public records request and submit that to the North Central Public Health District officials and see where that goes. That gives you the opportunity of appealing it to the district attorneys involved if you don't get, or if they just ignore as they have been doing, replying to that. That's just my thinking at this point, but thank you.
Thanks, Les.
Les.
We'll go over here.
Okay, my question, and it's probably covered as is this an official, like, contractual obligation to have to be in the strike down working, or is this something that's just kind of a at the table agreement we renew every year? And if it is a contractual kind of obligation to have this, would pulling out having ramifications on the community or on anything like that? That's
Yeah, so it is part of what's called an intergovernmental agreement. So it's a contract basically that we signed when we created the entity. So there's language in here, and I think it might have been Gilliam alluded to, the county has to give 180 days notice. We have gone through this before with other regional things that have dissolved, and I don't think what is typical of that time period when people were entering into contracts is they weren't very clear on what the divorce looked like. And so that is something that we've grappled with McCog and all kinds of other entities that we used to be part of that have since gone by the wayside. So I would anticipate that there will be legal counsel involved, not to say that there'll be legal action, but lawyers figuring out how to divvy up any assets. Sort of the key point would be to make sure that if the court makes a decision that we're hitting that 180-day window in a time frame that makes sense from budgeting and from when we would normally be making our payments, so that we're not on the hook to make a payment and then be out like 2 weeks later. So we would want to make sure that if the court decided to move forward, that we are mindful of those sorts of things. But other than that, it's really, I think, North Central Public Health attorneys, and it would be our attorneys kind of figuring out what that would look like, what the divvying of assets would be. Where we run into this before is sometimes there are surpluses that are sitting in accounts places and figuring out how to divvy those things up. I'm keeping in mind that they've been receiving Gilliam County's share of public health dollars since 2009. And so I imagine there will be some resources that are sitting over there that Wasco County, I will be blunt, will not want to come over. And so I don't, in terms of repercussions, there's not really anything that they could do to us, but there will be significant conversation with our colleagues in the other counties about how those assets would be divided, should we decide to pull out.
Yeah, and using divorce as a term is.
Yeah. It'll be like a divorce.
It'll either be a.
But I would say that they have communicated, both from the director and the chairman of the board, that they will support Gilliam County's decision in whatever they do. It's not like they're going, but they're concerned it's going to make some changes for them. They have to be aware, and I've been pretty transparent. Once it became public record in a Gilliam County court meeting, I picked up the phone and made some phone calls. So they're, I've been transparent with them and what's going on, and they want us to keep them in the loop. And,
yeah, and the chair called me last week to check in, and so we're in contact with them. They know that this is a conversation happening. They also understand because they manage their own budgets, and they understand that the county's right to decide what's right for the county. They get that. So but it will take some time to unwind if we should decide to go out. It's not something we would be able to say, okay, we're waiting for you next week. It would definitely be a long process.
What are the major assets that we're talking about that we have to figure out what to do with?
I mean, that's a good question. I don't know, the board may be in a better place to know what their budget looks like.
They've got some vehicles and things, and I don't know whether that would play into it or not. you know, they obviously have a facility down there, but, I think it probably doesn't have more liquid assets more than anything.
Probably more.
And nobody knows what that is because that's why you need attorneys.
So it's some vehicle is a major thing.
No, I said it probably, it's liquid assets would be the, you know, whatever money's laying in the pot that hasn't actually been used for Gilliam County that should have been Gilliam County.
I think also too, the breakdown of what the state gives, because Gillian already said that the state doesn't tell them what each county's getting. So when they've got the millions for COVID, how much of that is supposed to be Gilliam County COVID money? So.
And they've gotten, what was it, over $2 million.
Their budget is healthy right now.
Yeah, it's double what it was.
And they've hired a lot more people, but have we seen any of those people? As last I knew, those vehicles were Wasco County vehicles.
That's
That was part of,
and most of the
okay,
vehicles.
They have vehicles.
for mileage and insurance and stuff, right? Or for
Well,
gas?
They
and-
just have,
They just
have
approved
Yeah.
money from the NCDOT board to buy more vehicles. Too. So.
Yeah, because I know that that's what the, so I have a question.
Their budgets are not right.
Yeah.
They have a great website. It has a lot of information that you can click on and it'll show you their budget. And it's big, so you can love it, love it.
What, I thought there was a couple years ago that Wasco County had thought about pulling out of this to begin with. And what was their reason?
I couldn't tell you, but I know that's been.
I was on board during that time. And you guys had said that it was something about there being a 50% that goes back to 2019. The budget meetings were all executive at that time, and during that time they moved to executive only. So like it was only once every quarter that they allowed commissioners to be present or to have a say. But I believe at that time one of their main concerns was they felt they were paying too much. Wasco County was paying too much, and I thought at that time we significantly increased our contribution. Is that not true?
We have that here if anybody's interested.
So,
Yeah,
but that was a big concern of theirs. And they were having the same problem we have. Wasco wasn't, or North Central Public Health District wasn't even willing at that point to give Wasco County a presentation of what sort of services they provide, like numbers wise.
That was a little bit of a director versus, yeah, there was a lot of dynamics.
Director and administrator. The largest increase for the Gilliam County contribution was between the budget years 16 and 17, 17, 18, and 18 and 19. So in the budget year 17, 18, Gilliam County contributed $108,768. The next budget year, it jumped up to $127,144. So maybe that was that time.
And I do, again, because we've alluded to this before, I mean, Gilliam and Sherman do have these pots of money, and I think for Wasco County, even though they are a bigger county, they do not have as much discretionary money per capita, and so it is not uncommon, I mean, all three of us sit on boards that involve Wasco County. It is not uncommon that money comes up with them, and then looking at our SIP money, thinking that that looks like a good place to fill their budget holes for their health department.
They've got some payroll issues coming up in the next year over study of wage study that's going on. There's going to be some substantial wage increases at North Central, probably in the next budget cycle.
But they did not want window machines. I worked in a planning office. And they were very snobby about not having any wind machines.
They've got a lot of solar going in right now.
So I kind of like to get a sense from folks. I mean, some of you who came to this meeting probably think you were coming to a different meeting. And I think this has been, or at least for me, even I know something about public health and I still learn private. So I'm kind of wanting to get a sense from folks in the room. What is your general sense? Like if you were sitting, if you were in one of these chairs, and I'm not gonna hold you to it either, to vote, but is this something that you think the county court should consider, continue to discuss and consider? Bringing public health back without necessarily getting into the details of who's running it and what it looks like and all those kinds of things. Just a general impression that you've gotten from the meeting so far. If anybody feels like, maybe show of hands, who thinks that we should continue to have this conversation and look at bringing it back?
Judge, this is Steve Schaefer. Just want to make a quick comment. I think the feasibility study, what Daleen has done is fantastic. I think we should do whatever we possibly can to bring it in-house. I think the dynamics are completely different today than they were in 2013 when it was handed to me. I firmly believe that we're in a position today that we can handle our own public health, and I think we can do a much better job than what was done specifically during the COVID times. Got my 2 cents out, so thank you.
Thanks, Steve. Appreciate that. So, and for folks on Zoom, if you can do your hands too, you can. So let's do it one more time. Folks who think that the county court should continue having this discussion, that it sounds, at least on the initial blush, that this might be something that we should do. So it looks like we.
As long as you hire somebody else.
Yeah. Okay, so let's talk, I mean, I think we sort of discussed bringing public health back. From what you've heard so far, are there any initial concerns that you think in particular, like, was there any red flag? Like for me, when they first approached, my first thought was, this is gonna cost the county more money, right? That's my job to think about. Did anybody have those kinds of questions that you could flag for us so we can, one, make sure that if it's not in the feasibility study, it's addressed, or that we can do additional research? Feedback on them. Let's go here.
Will there be services available to us? No, as available as they're making it to us, that won't be available to us.
Got it. Haley?
I don't believe so. No, I believe that we are capable of doing the same services that North Central is able to do in Gilliam County to see if it balance. And we would actually get them. Readily available.
Mark.
Yeah, my thought is that we sometimes have north and south issues. And I recognize that you're more rural, we're on the freeway, we can travel to Hermiston and the Dallas in a very short time to approach these services. And I have no problem that it's more functional down there. I just think, as the chairman of North County Health, I'm expected to ask a question.
Okay.
That our services, are we gonna have to go to Condon or will your services be provided down at our end? So, because we have to travel there or we have to travel there, it's not this different.
Okay, yeah. So that's a really good question, and that's why we thought it was very important to reach out to the Arlington community and ask them what their needs are. So once the assessment, we'll have to reassess because we didn't get the information that we needed the first time we asked for it. So we're not going to give up. We're going to keep prodding. And once you get that information, you do an assessment of what your needs are, and then you figure out how you're going to implement the programs. And I'll give an example. We keep talking about immunization. We have actually came down, a provider and a medical assistant have gone to waste management numerous times to give vaccinations. And that's the kind of feedback we need from the clinic and the school. We did receive some from the both, but how many times do you need it? I mean, when do you want it? And we could come down here. It's just planning ahead. And we were hoping to get a little bit more specific about the patient needs from the clinic. But once the assessment's done, then you'll be able to determine what programs to implement and work together and how are we going to implement those.
Well, and overall, I feel comfortable that will happen. Really do.
A question.
Go ahead.
You in the when you were speaking, you said that like Wheeler County donate, contributes $2,000. Gilliam County is $138,000. What does the state of Oregon give to Wheeler County to run their public health? I don't remember you saying that that amount.
And I did.
I'm just curious.
Yeah.
Just curious. Yeah.
Sure.
Good question.
It's like, what are we talking about here?
Yeah, so, as she said, Shelby is the one who runs the, public health in Wheeler County, and she, was as kind to show us she opened up the books to us. So what you have to do is go through and see what programs they are implementing.
Right.
And so from, this report, we had calculated non-COVID money for them. They received around $112,000. Yes, from the state. But their contribution from Wheeler County, I believe, is $2,500. And it used to be zero for years, and the state did step in and say, you need to have something, whether it's $1 or something, to show that you are acknowledging that, you're going to contribute a little bit. So
But then expecting that, that same basement, because I'm assuming the program elements that they're doing in Wheeler County are gonna be similar to what we want to do here.
Yeah.
And then you get that same base plus a slightly increased per capita, as we do have more people than they do.
Correct. And the feasibility study will show a little bit more detail because it gets very complex about how they come up with the formulas and stuff for calculating how much money that. And there's a whole nother entity, and it's called Flow, that that each health district goes through, and they're the ones who go then to the state and request funds.
So you have an idea what Wheeler County is getting from the state. You know what Gilliam County is paying North Central. What's it going to cost you to do this?
So the proposed budget will be, the operating budget will be in the final report.
But you surely, you have to see that this is feasible.
Yes.
Have an idea where you're at.
Yes. So what we did because it's hard to tell, how much money you're going to get, because without knowing ahead of time the programs, we went off Wheeler County.
Yeah, I wouldn't be, I was just wondering where you're at with those numbers, because it really gets down to your expenses at that point and what you got for your. You take North Central and they just put Shelby in permanent director and her wages around 100,000, so they would count as well. Start looking at those kind of numbers.
Yeah, so we budgeted low for the amount of money we get from the state. And then, as you know, we know the amount that you give, and we added 3% because that's what you've been doing for next year. So the total resources that we are using to operate is $238,203.
And that includes outsourcing your environmental services and.
Correct. And there are options to outsource, and we're hoping that after the divorce, that maybe they'll share custody. I don't know, but we're hoping that maybe there's an option. We're willing to look and contract back for the environmental services.
They're real weak in that area right now.
Okay, so we have 2 other options. So that's the only thing that we see that would cost money to contract out. And worst case scenario, we know what Morrow County pays to Umatilla and how they formulated that. So we did estimate, again, based on what if we went with them, after talking with them, here's what we think maybe it would cost us to contract out for the environmental. Did you have a follow-up? Yeah. Did you want to?
I'm curious about the new number of governmental programs.
Yeah, let me, oh, do you have it? I have there. Right on top here. I haven't.
Let me get my binder.
For this one.
Folks, while they're looking that up, is there anybody on Zoom who has a question, comment, concern is really what we're sort of surfacing right now? I'm not seeing anybody on mute.
No, we're losing participants. Everybody's dropping off.
2 hours of public health is a lot.
Yeah.
Yeah. So we're losing.
Yeah, the numbers are going down.
We've looked through all the different programs that are possible and out there. Have a list of ones that we feel like could be utilized.
Yeah, I don't know who that was.
So we'll go to Steph, who's on Zoom. Steph, got a question, comment, concern?
Hi, yes, I think you might have touched on it. I was on the road listening, so it kind of cut in and out, but are you thinking that there'd be a new building that would need to be built or use existing facilities? Or I guess I'm just curious, like, who would do the hiring of the staff? Is this going to be a county commissioners thing? Or I'm just wondering how it would filter down.
So then Holly, can you speak to the building and then I'll speak to the governance?
Okay, so our plan would be to start out just trying to fit it and run it out of our clinic. And then, you know, after running for a while, figuring out what programs, what the needs are, we would have to reevaluate, you know, space. There wouldn't be a need for a large amount of additional space, but there definitely would need to be maybe an additional exam room and a couple offices built onto our existing clinic down the road. But to start with, we would make it work.
And in terms of governance, so this gets into the weeds a little bit. Most people are going to glaze over, but technically in counties, the county court is the public health authority, the board. And so we are talking to legal counsel right now about if we were in essence contracting with one of the health districts to provide public health services, how that looks from a governance structure. So I don't have a good answer in terms of like, and that speaks to your hiring sort of question. So we're still waiting from legal counsel to see what the parameter is for that, or whether a whole new board would need to be created or what that would look like. So I don't have a good answer on that. We're waiting from legal counsel to just kind of get a sense of what's even possible under Oregon law.
So do we know what Wheeler County, Moore County, what does theirs look like? How do they govern theirs?
Yeah, Wheeler County, we do know. And that's a little bit more complex in there. They're making do with the way they have to do it. But as Liz said, the statutes dictate how you can do this. And one of the ways was to form, you have to have at least 2 counties that form a health district. And that's how you could grant authority to them, to North Central Public Health. The other one was what we're trying to go under is the fact that we are considered, being the South Wheeling County Health District, a government entity. And the response we received from the state was that they see nothing that says we would not be able to contract with you, but you hand over the public health authority to us. But that is still, like Judge Farr said, up for the attorneys to discuss and decide.
Do you have a question back there?
Yes, if Holly's saying that we're gonna need to add on additional office space and exam room on our clinic, I think Mark can answer the question whether they're thinking about locating it as far as for the administration and
Well, at the same time, I really don't want to necessarily make an issue out of that at all, but it's there. It may make more sense down here, and I can accept that. And so I don't really.
Well, I can be upfront
like
with you.
be
It has been my intention all along to run it out, absolutely, because we have a physician, and then our PAs, the way we budgeted, about 15% of their time would be dedicated to public health. And then the new position would be the administrator. And then again, that you have to have a starting point, and then as you develop the programs and figure out, what you're going to do to see if you need additional staff. So we have to estimate and come up with something, but it could change. So as more programs you do, might be the more money you have, so you can hire additional staff. But you just don't know until you get into it.
I think it would make it a lot more attractive for the entire county if you had an idea that you were going to have the public health people or personnel or the ones that are necessary in our clinic in Arlington, say 2 days, 1 week, 3 days the next, and do back and forth like that. Then, I think you have a lot easier sell to the rest of us, because we like what you're talking about, but we really don't want it to just be up there where it costs us much time and effort to go there to Dallas and
Right.
more dangerous driving.
Yeah, absolutely. And that's a great point. That's why the assessment is so important, and why we reached out to the clinic to ask them, what are your needs? What do you need? We didn't get the kind of response that we needed to move forward.
We need the same thing that you do in Punch. That's what we need. We all need the same thing. It's not a rocket science. It's not a rocket science question. If you have needs in your city, we have the same one.
Well, and that's the benefit. One of the benefits about having the local public health is that you can tailor it to your needs. Like our needs are going to be a little bit different because we run immunization out of our clinic. You guys don't. So we would have to figure out, when do you need us to come down here and provide that for you? So that's one of the examples.
We got our shots here.
So kids
So-
shots. Yeah. The
That was-
ESC, the immunizations for children.
Well, that's
We do
why
not
it's
have that.
important for you to
Yeah.
have a certain amount of days that you operated up there. We're all part of the same county, the same family.
Mhm.
We all need to be treated the same, fair, equal. And that's, I'm throwing that out as an
Sure.
obvious solution, that if you spend half the time up there and half the time down there, down here, or maybe you have a bigger population, maybe it's 2 days here, 3 days there. I don't want to pick the pepper
Yeah,
around,
well,
but,
that's why data is important, and why we try to reach out and get some information. How many people out of Arlington are getting their family planning services through North Central Public Health? It's a matter of putting a zip code in and pulling up the number. So it would make sense if you only had 2 people in a year utilizing the family planning services to send a PA down to do, to sit around here.
so do you know that number for Condon then? You've
No.
asked us for it, but do you have that number for your own town?
No, we asked North Central Public Health for that.
North
How
Central
many
Public
are they servicing, in Gilliam County? And we cannot get that number from either, yeah. And so all we know is by what our patients tell us. If they say, oh, well, we went down to North Central Public Health, that's all we know. But we reached out to the clinic to ask them specific questions about what the needs are for your community and their patients.
I think you guys are on the right track. I just want you to see the sense of fairness, because we're all in the same county.
Absolutely.
We need to be represented in both plans.
Absolutely.
And I don't want to see the budgets change where we end up giving more, getting less, like we're complaining about now from North Central. I want to keep that in perspective, our SIP money is our SIP money. Your clinic needs to support itself within and of itself. We do the same here, and everybody's happy.
So one thing too, I can throw out on this whole, because I think this was even maybe brought up in context of North Central Public Health, and that we put sort of a service level agreement expectation for North Central Public Health and what they would deliver. That is something that we could potentially look at in terms of structuring the agreement, should the court decide to go forward with one of the districts providing the service, assuming that it's the South District. the court's expectations on what that service level looks like for both communities. So that would potentially be a place where if folks at the north end are nervous about, I mean, I know Martin said he feels like there's a good relationship there, but if folks felt like they needed to have sort of that additional level of assurance, that would be something maybe that the court could look at baking into an agreement, setting an expectation to the South that, hey, we would like you to be physically in Arlington X number of days a week or whatever that may be. So that is definitely something that if folks at the north end feel like that would be useful and give you a sense of ease and sleep better at night, I think that's definitely something our legal counsel could do should the court decide to move forward.
And I think also an important thing that I've been surprised it hasn't happened is the accountability and the reporting. There, I would think that annually, North Central Public Health should be going to the county and reporting to them and saying, here's what we've done
Here's
this
what
past
you get
year.
for your money.
And we would be able to do the same thing and be able to provide data and talk about the programs and all the agencies that we work with. And I think that would be important to put in the agreement also.
So I'll go to Rita, and then I've got Cindy Hinton on here, and then Mayor Buckton. So Rita, did you have something?
Yeah, I was just wondering, if it's all written out common, it will probably mean that the clinic down here will be just a standby group.
No.
There's no
It
It doesn't
It just supports it more than it's been supported.
Okay, so
It will not change anything.
So they'll still have a practitioner and
It has nothing to do with your fire EMS clinics. It's a totally separate entity alone.
It would be if there was a provider there to do STD screening that the state paid for, or to give shots that the state paid for, or to do birth control that the state paid. So like a totally separate, very specific services that the public health does. Public health doesn't do, pills, back pain, screening as far as, health stuff. But the public health does those specific parental health level. But all the tobacco accounts, serves alcohol, not not the day-to-day clinic. Yeah.
Because they've already almost lost, I mean, the clinic is kind of unexisting for a long time.
And this would be in addition to what they do.
We'll go to Cindy, and then we'll go to Mayor Buckton. Cindy Hinton?
Yes. So in that public health is supporting the clinics, and I had trouble hearing some of Rita's comments. The audio was breaking up a little bit, but that's my vision, is that the public health supports our existing clinics at the north and south end. And I think the fact that we are able to have a good relationship with Wheeler County and getting information from them, they are providing those supportive services in 3 communities throughout their county. And I think they would be a really good resource on how we make sure that those resources are spread, to the gentleman in the back of the room, to make sure that services are provided locally and equally based on these, the programs that we create, and also trying again and again to get more data about where those needs are. So if we can get some more of that information, then we make sure that those services are provided locally. Does that make sense? That's what I see.
Folks are nodding in here, Cindy.
Okay, great.
Mayor Buckton?
Yeah, you asked earlier, if anybody was, support and how they feel about it. And I think this is a good program. I think anytime that you can get independence, from other state or government entities, I think that's always a good thing. I caution myself not to make any decisions now because I haven't seen the feasibility study. And I think it's hard for any of us to come to any conclusions without seeing that study. I do have concern that, it may end up with some diminished services in our communities, be it south end or north. And I hope it doesn't get down to something like that where a lot of the stuff becomes centralized, because the folks in the community like the ability to, have that 1 day service if they need it within their community, and not have to worry about, carpooling somewhere or whatever. I realize those services are always available, but it's not that they're convenient. So I kind of hold judgment or conclusions until the feasibility study comes out. I hate to see if, we're already making assumptions about who's going to run and operate the programs and how it's going to already work without knowing what the study says. So, and the last thing is just kind of a joking standpoint. Earlier in the meeting, it was stated that, this is not going to cost any of the public any extra money. I just alluded that to what the feds are telling us right now, that no, your taxes aren't going up. So that's kind of where I'm at with this.
So, any other, I think I want to get into a conversation next with the commissioners on what they see as next steps. But before I do that, I want to make sure that we haven't skipped over anybody, or there aren't any last sort of parting thoughts that folks want to share. Go ahead.
Curiosity, you mentioned once we establish these programs and they're state qualified, the state starts funding. Correct? So where does everything come to start all this? Where are we going to get the funding?
So the feasibility study will get a little bit more into detail about that. So if, I'll just give you a scenario. If the county court were to make a decision to pull out and to create Gilliam County Public Health, I would hope that they would do it before the end of the year in order to give their 180-day notice. Once they do that, then there would be a 6-month transition period for us to build our public health. And that is working with the state to do that. And so there are transitional costs involved in that. So that it's just a total estimate, because the funds would not come in to the new entity until July 1st. Because that's when the budget year starts.
That didn't answer his question. Where's the money coming from?
Are you saying that the state, we've got a 6-month period where the state's going to help us?
So,
not actually fund our programs, just help us try and get it started?
The budget year runs from July 1st to June 30th. So North Central Public Health, even if Gilliam County pulls out, they are providing public health services from January to July. They're paid to do that. But during that time, there's an overlapping time, we would have to work with the state to get the new one up and running, so they're ready to open doors on July 1st. So there is that 6-month transition period where it would cost money.
So
we're kind of hoping then that out of that 138 we give them, maybe we could use that.
So potentially in the divorce, what we could look at doing, and this, we do have some precedents for this. When McCaw, which used to run building codes, people may remember this, they dissolved, and the 4 entities then had to decide how they were going to break up the building code funds. Well, Wasco County decided to create their own building codes, and they used some of those leftover funds when we divvied it up in that divorce to go towards their startup costs. So I could see a scenario, for instance, where the county may float the money, basically while we're working out what the divorce looks like, and that some of that money then that's coming in, depending on if it's earmarked for specific things, obviously we can't necessarily use that for startup, but if some of our money is coming back to us, we may have that free to be able to put towards startup costs potentially. But that, again, will probably be something our attorneys are going to have to look into, and then our financial folks are going to have to make sure that it's tracking, because a lot of that money will be earmarked for certain programs that you can't just say, okay, we're starting a new health district.
Correct.
Potentially, yeah, but if they're sitting on reserves from what we put in, potentially, if we get some of those back, those could potentially be put towards startup costs, and the court would just basically need to float the cost until we get those funds back.
So would that mean then we'd be able to say, like we would, hey, this year we're just gonna give you guys 50 instead of donating 138,000 to help out with the state funding situation.
So those are all things those are all the big questions. And when we started, did I have any questions? Those are my big questions. How do we budget? What are the costs? And I think that's gonna come to us when the feasibility study is actually presented, and we can see what those budget numbers look like. And we're gonna go from there.
Yeah, but preliminary, we have done, our proposal is there is no additional funds. None. We're estimating.
3%, Holly.
Oh, 3%. You're right, because they increased it 3%. So I just took what the county contributed to North Central Public Health last year and added 3% to it. And that is what I used to create the budget.
You were saying something about our cost right now, it's about 2%.
So what, no, so the estimate of, I took the county number and then I estimated the state number at 95,000. I really don't know what it's gonna be because I don't know what programs, but we were conservative and went off what Wheeler County gets. So I just used 95,000. So what the county gets and the 95,000 state is where I came up with that one. It's just a guess, it's kind of estimate, you know, you estimate, you guess, and, but that is how I came up, that's how I came up with it.
So any initial or any final sort of thoughts before the county court gets into the next step? Anybody? Did you have one?
Actually, mine was, so this is basically just establishing there isn't consistent progressing with this idea. Will there be another meeting later once we make a decision? Depending on will there be another meeting open to the public where we can comment to discuss any kind of structural foundation, how that goes?
Absolutely.
So please remember that anytime the court talks about it, it's a public meeting. You're welcome to come and be part of that discussion.
But I meant kind of just like the groundbreaking, like where we're going to go, you guys will have kind of stuff like
absolutely.
it's more structural.
And that is a great segue into talking about what the next steps look like. So I've already referenced that we need to actually receive the full report. So we are scheduled to do that next week, the 6th, which is our regular meeting. That's over Zoom. So if you miss it and you want to go back and hear more public health glory, it's on our website. But then I want to hear from the commissioners what you see beyond that.
At some point, should we include representative from OHA to just kind of walk us through the process of that?
And we have one. I have a really good contact. Yeah, he's the liaison for our region. So
I just think that, you know, there might be some questions and things that they would know.
And can we bring county council to help us with some of these questions that we have, and we say that would be something county council can well.
Maybe get it for council.
Yeah. So folks understand kind of how I think this might roll up. I'll just kind of lay out what I think is that it sounds that we will receive the full report during the next meeting. I think we might be able to aim for the second meeting in October, and I'm sure Teresa's taking notes, to see if we can have OHA possibly join us. And I can also see if our county council will join us, although I will say that they're probably going to say some of these are going to be in the details. Like, we don't know how much money we would get from North Central Public Health until we have that discussion, basically, and say, hey, we want a divorce. Some of those details are probably not, they'll be frustratingly slow to come. But if the court decides, at least in concept, to move forward, we will need to give notice to public health that we're planning on moving. At the same time, I would anticipate beginning negotiations with South District, assuming that is the direction that the court decides to go in terms of creating a contract and what that would look like. And so our attorneys will do an initial draft that likely would come to the court at least once. But it sounds from the feedback is that the public would like to see that maybe a couple of times. And so we'll try to figure out how to schedule that so that folks have time to see it and provide feedback to the court and our legal counsel. And then ultimately what would happen is that our board would have to approve it, their board would have to approve it, it gets signed, and then there's an effective date and it would start from there. Should, of course, I will say this all, this is not a done deal. The court needs to actually consider it and decide if this is what they want to do. But this, I can just say, I am thrilled that people are engaged about public health. I feel like this is a really helpful conversation for us. I appreciate all of the engagement from everybody, the great questions, the open-mindedness. I think to what I heard was people very much having an interest in the county as a whole and what public health should look like here. So I just want to thank everybody for your positive engagement, your fantastic questions. Commissioner, do you have anything else to add?
No, I would agree with those, but it's great having the public part of the process.
It's amazing, honestly. You guys should come to our meetings. They're all this exciting.
No, they're not.
So with that, it is 6:27. Unless anybody has anything further, I will go ahead and run the meeting. And the county court again will be meeting our next regular meeting next Wednesday at 10 a.m. It will be on Zoom, so if you do not want to drive to Condon, you can just watch from your home or office or wherever. And this will be part of the conversation, sort of the next step.
Is it on Zoom and in person?
It is. Yes, we will be at the courthouse in Condon and also on Zoom. And the link, yes, the links to the report, I'm thinking we'll probably have it on Wednesday. So our IT person actually comes in on Tuesday. So let's just say that look for it on Tuesday. I'm going to probably have a chance to get in and actually get it on the website. All right, thank you, everybody. This is wonderful. We're adjourned.